Hi, this is Tori Novak, and this will be video 3 for my midterm skills assessment. This particular video is going to be over non-invasive ventilation. Again, I don't have a mannequin, so I'm just going to be using my little head to show you how the mask fits, and I'm going to be using a test lung as my patient. So I'm just going to begin by kind of going over some things with the ventilator. I'm going to be using the V60 BiPAP, and then we'll input the settings. So this right here is the V60 that we're going to use. Anytime you use these machines, they need to be plugged into the red outlet so that they're hooked up to a backup generator should you need one. They can hook into the wall oxygen, but they also do have 2 e-cylinders with a flow meter on them just in case for emergencies or transport, etc. I'm not going to waste the oxygen, but I will talk my way through it as best I can. So first I'm going to show you how to apply a mask. The mask that I have is a full face mask on your patient. So this, can't see very well, this is my patient, and so to apply the mask that I chose is the mask that we have in our education materials. So it doesn't fit in perfectly, and it should fit your patient very nice and snugly, but for the purpose of the video, I'm using my resources that I have. So to use this mask, it does come off on the sides. So you can kind of wrap this around your patient. You want to have a nice firm seal against the nose and the chin, and then the back part of the headgear just wraps around. And then you can just adjust for the best fit for your patient. Let me get him a little closer so we can see. Here we go. Okay, so we have the nice tight fit around the nose and the mouthpiece. I'm going to go ahead and adjust here on either side so we're getting the best seal that we can. And we don't want it to be so tight that it's causing pain to our patient, but we want it to be tight enough that we do have a nice tight seal. So we have a nice tight seal along the mouthpiece, and we have a nice tight seal along the bottom. So then this is where the mask will hook into the BiPAP machine. So that's kind of how it looks. This guy's head isn't exactly how a normal head would be, but that's sort of the basis of how this particular type of mask would work. There are several other masks that could be used as well. So with that being said, that's the hookup there for our mask. And then I'm going to go ahead and talk us through the BiPAP and the settings. So here's the V60. These can be used heated and humidified or not. This particular setup is not. Over here we have, this is what's going to attach to the patient interface, and in our video today I'm going to attach it to a test lung because I don't have a mannequin to put it on. And then over here, this is our pressure that hooks onto the side as well. You can see that we do have the e-cylinders, and we have the Fisher-Paykel humidity system should we want to use it. So that's sort of the basic exterior parts of it, and as I said previously, it's always plugged into the red outlet. So we're going to go ahead and turn on the machine, and we're going to set the settings set by you. So to turn on the machine, we have this little power on button. Okay, so it's telling me we have a patient disconnect because I don't yet have it hooked to my test lung, and it's also telling us that the oxygen is not available. I do not have it plugged into oxygen because of the room that I'm in, but this normally, of course, would be hooked into oxygen. You can run, excuse me, let me get this switched around here, sorry. Okay, so this can normally run from an FiO2 of room air at 21% to 100% oxygen. And so we're gonna go ahead and set this setting. So we've powered on the machine. We want this to be on spontaneous timed. So to do that, we're gonna come over here and we're gonna go to modes. Under modes, we want batch spontaneous timed. So we have that setting in place. Then we're gonna adjust our settings. So we want our IPAP at 15. To change the IPAP, this is how you would change it. We have 15, so we're gonna go ahead and accept. We want our EPAP at 5. Same thing, you just adjust using the arrows and then accept. Our respiratory rate of 16, again, click, adjust, and accept. We want a respiratory rate of 16, which we have, and our FiO2 at 60%. And again, you just back and forth to adjust, and then you accept. And then what you need to do is set the alarms. So you're gonna set the alarms for various different things on this particular, wants to run away from me, on this particular setting. So the settings, okay, so the settings that we can put on this ventilator are the high rate, which usually around 35 or so is a good respiratory rate, high rate. Low rate, I said to go ahead and set that at 8. 12 to 20 is normal, and so 8 would be a lower number. We don't want our patients to be apneic, but we want to be alarmed if they are not breathing as much as they should be. So then other settings that we would set would be a high tidal volume, a low tidal volume. Sorry, that alarm's just telling me that my oxygen's not available. We set the high inspiratory pressure, the low inspiratory pressure, the low minute volume, and the low inspiratory pressure time. These settings are all based on your patient, and since I don't know very much about my patient, I don't know their size, so I don't know what a normal spontaneous tidal volume would be for this patient. And so without knowing much about my patient, it's really hard to set these alarms appropriately. So I just kind of did a little rundown. So they say that a normal low inspiratory pressure time is about 20 seconds. The high minute volume is going to be 50% higher than the spontaneous minute volume. The low minute volume is going to be 50% lower than the spontaneous minute volume. The high inspiratory pressure is around 10 to 15 above their peak inspiratory pressure. Their low inspiratory pressure is 2 to 3 below EPAP, so we could say that would be about, well, our EPAP is 5, so that would be around 2 to 3. The low minute volume, I think I said that was 50% below. Low inspiratory pressure, we just talked about. The high tidal volume, 50% above their spontaneous tidal volume, and their low tidal volume should be about 50% below their spontaneous tidal volume. So that's how you would set those rates, those alarms, based on your patient. So you have to know a little bit more about your patient before you can actually set those alarms. But that would be how you would set them. And you would set them by going to alarm settings, and you can choose all of these options. Again, you just click them and dial them in. So that would be where you would set those settings. Now, it wants you to adjust the ventilator for the ABG of a pH of 7.32. Sorry, that's just my oxygen supply not available again. It wants you to adjust for an ABG of 7.32 as a pH, 66 for a PaCO2, and 82 for a PaO2. To me, my first thought when I see this is that's not really that bad of an ABG. Yes, they need to ventilate a little bit. Yes, their oxygen's a little low. Yes, their pH is a little acidic, but it's nothing extreme. So in my opinion, the first thing that I would want to do would be to maybe just increase that respiratory rate. Maybe we would just go ahead and increase it to 18. So I will go ahead and demonstrate. So I'm gonna just go ahead and dial that up to 18. My hope with that is that by having my patient breathe more, they're going to be able to blow off some of that CO2. Therefore, hopefully, it'll raise their pH. So that's my first thought. So, I do that. I'm going to check in. Now, if that's not helping that much, I might change my IPAP, because IPAP is what IPAP is what helps with ventilation. So I might change that IPAP to EPAP ratio. I might say, you know, let's turn up the IPAP a little bit. Maybe let's do 16 and 8 and see if that helps. You know, and then check. We are only going to change one thing at a time. So check that, see what's happening. If that doesn't completely help, maybe I need to up my FiO2. Maybe I'll change it to 70% instead of 60. Those would be my top 3 options on how to treat that ABG. Like I said, really isn't that terrible of an ABG. And not knowing that much about this patient, you know, we don't know. Maybe their PaCO2 runs a little high. Maybe, you know, 50s are their normal, or it's just that alarm again for the oxygen. You know, maybe their O2 levels run a little low. So without knowing that much about our patient, those would be my first options on how to treat that ABG.